Hi, I'm Allison Santoro from CNY Fertility's Donor Egg Program, here to talk to you about gestational carriers. After discussing with one of our physicians and determining that you do need a gestational carrier, your next step is to contact a reproductive lawyer. A reproductive lawyer will help to answer questions that you don't even know to ask. Here are two reproductive lawyers we generally refer our clients to. We do not offer gestational carriers at CNY Fertility, so you will need to seek out your own gestational carrier, either through a friend, family member, or gestational carrier agency. Once you've determined who that carrier will be, you'll need to have her contact our office to become a patient. Once she becomes a patient, our donor egg team will reach out to her to coordinate her workup. The first step to your gestational carrier's workup is a complete physical and medical releases from her primary doctor and OBGYN. She will also need preconception labs and a saline sono to determine that her uterine cavity is normal before proceeding. The next piece to your gestational carrier's workup is a mock cycle. If we plan to transfer fresh embryos to your gestational carrier's uterus, it's important to determine ahead of time how her uterine lining is going to respond to estrogen. The next step in using a gestational carrier is determining whether you are planning to use donor eggs or your own eggs. If using donor eggs, you'll need to contact one of our donor egg recipient coordinators for the donor selection process, and please refer to our donor egg recipient video. If using your own eggs, it is very important that you contact our donor egg team. New York state law requires that FDA blood work or infectious disease testing is completed within 30 days of your own egg retrieval. Your next step to using a gestational carrier is to determine the sperm source. If we're using donor sperm, that sperm has already had its FDA testing. If we use partner sperm, it is recommended that we complete the FDA testing or infectious disease testing and freeze that sperm sample ahead of time. Because FDA testing is required, it's also required that that sperm is quarantined for 6 months. For this reason, we do counsel your gestational carrier, and we will offer her an option to sign a waiver for that 6-month quarantine. Thank you for watching our gestational carrier video. If you have further questions, feel free to contact our office.